I know that this area is related tightly here. And here we find the biggest one, like the patient is just going mad because we touched that. And then I know that most likely this neck issue is the result of this fracture. And very often, just after working here, patient sits up and, wow, this didn't feel like this for years. Sometimes it works. Sometimes we need to do the local work. In most of the cases, we need to do the local work, but I always give this chance for this magic moment to happen, to release that, and then they sit up and they're like, wow, like their neck is like new. Then we can work a little bit locally, and they are happy. And I know that if I would release this, if I wouldn't release this, even if I would be the amazing manual therapist, if I would release all of this, they would feel better. But I know I would see them in a few weeks. Theoretically, great from the marketing perspective, right? I could spend with people 15, 30 minutes, work on that, and I knew that this will be my patient for eternity because I provided them solution lasting for long enough. But since I'm not very good with marketing, I also work here, and the problem doesn't come back. The problem, the improvement that they see is that they have less pain, the pain occurs less or never, or they have to stress themselves much more to get the same pain. So with athletes, for an example, I have this specific type of improvement that we measure. If the neck pain, for example, was kicking in when someone was benching 160 kg, then if the same pain kicks in when they bench 170, that's an improvement. And then 180, that's an improvement, right? And at some point, the pain is resolved, right? Sometimes it takes one session, sometimes it takes up to 10. It depends how many injuries someone had.
Is the pain always an indication that, for example, something is wrong? Because I know that some people usually still have pain, yet for a long period in their life, basically, but they don't get injured. So is pain always an indication that something is wrong? Or can people live with pain normally? Can pain be a normal thing?
No, the pain is the information. Pain is the information. It's not a perfect information. It's far from perfect. If the pain would be perfect, if our evolution would provide us with perfect receptors, with perfect perception, I wouldn't be needed because it would be that simple. But unfortunately, the pain mechanism, it's not. If the pain is there, it's about balancing between two things. Now, let's assume it's a psychology. Let's assume that it's a psychology session. Let's assume that I was invited to a podcast. Very nice podcast, right? Now I'm stressed like hell. I'm stressed. Now, the fact that I'm here is a balance between what is stressing me out. Maybe the fact that you will ask a hard question that I will not be able to answer. Maybe that I don't know what will happen. Maybe you are not a nice person. Maybe you will not be able to make me comfortable. Maybe if I ask more questions, I will figure out that it's because of my relationship with my father, or I will allow these feelings to come, wait through them, then I would be relaxed, and I would be able to come here a bit more lighter, right? And from the other point of view, you have to just push through that, just go there and move through that fear, because there will be never a perfect moment, right? There will be never a perfect me that will come here and will just smash, tell everything perfectly. It will not gonna happen. And it's the same with pain. If you feel pain, it requires you to find a solution, because if you feel pain, it means that something is off, either from physical part of health, chemical or psychological. But you have to go to the gym. You have to go to work. You have to push through pain a bit. Sometimes you have to take a painkiller because the solution, the therapist, the root cause, it's not yet known. but you have to do it right now. So you have to push through pain. And to the massive extent, it's very safe. You can train a lot with quite a lot of pain. You can go to work and work with pain. And the fact that the worst thing you can do is to stop yourself from doing these things because of the pain. Okay, some people are afraid. They need reassurance that that's normal. But sometimes we don't have a choice, right?
Is pain always physical? Because you mentioned psychological. Can pain, or let's say, can we pinpoint that sometimes pain could be related to psychology or our mentality, our mindset?
Now, yes, I'm sure that this is happening. It is happening. The psychological pain is a little bit different. Now, it's hard to pinpoint, and I'm not the expert of that. Sometimes it happens during the treatment that we resolve something psychological. So I work on something, thinking that it's mechanical. Patients relax, they cry a bit, right? Or they tell me a story of their life, of their injury, and I see that they're going through that. Yeah, physical and psychological pain are like this. Like basically, if we work with this, the psychological will also improve because there is a psychological part of every surgery, every injury. Sometimes I am the right therapist for resolving the psychological pain. Why? Because I work on that area. Patient has flashbacks. They tell me their story. Someone listens to them, and they are better. When there is I had a patient that sprained his ankle massively, like massive sprain, and he was like mentally in a very bad place. I was sitting next to him, like, okay, like I did well. Like we gave him quite a lot of improvement. I was sure it's psychological, but it turned out that because of this sprain, he decided to quit cigarettes, quit smoking, to improve the regeneration, which is a great idea. But you know how people act when they quit smoking. So it's theoretically psychological component, right? He had a big injury, then he quit smoking. So mentally he was in a place where I didn't feel like relaxing. It happens, right? So you see, it's a little bit of wiggling. But returning to the question, very often if there is a big emotional component, patients sound dramatic. When they explain something, for some people, fracture, sprained ankle, knee surgery is like happens to everyone. Bro, it's like we cannot do it. Happens, right? I knew the risks. It's okay. For some people, small thing, when they tell about it, it sounds like the worst thing ever, like someone tortured them, like when you listen to the darkest stories, even though it's a simple ankle sprain. And that's valid. It all comes down to a few points. All comes down to the role of the injury in their lives. So how much did they need that knee? Maybe this football player that had ACL, he already assumed that he will not play longer than 1 year. So he don't care that much. Like, okay, it's sooner than later. But someone can stop going to work. Or they cannot extract pleasure from work because of the pain. And that's already a massive thing. And then something smaller, the same injury, but the whole environment is different. Then the psychological component will be bigger. I love to work with these patients because I can really help them. Okay, now I'm not sure if I answered your question directly because sometimes there is an injury and there is a psychological component. When we improve the knee, for example, patient feels better because finally solution, we move forward, great.
So psychologically, automatically, like it's going to be better automatically.
Exactly. But I think you asked if there is a psychological trauma and then there is a pain, psychosomatic pain. I think you asked for that. So there is also, when patients tell me about their problems, I listen carefully and I look for this dramatic sound in what they say. If it's there, and if there are no injuries, if there are no surgeries, then that's a big chance that it's going to be this. I can never tell, but what I do, I just do local work very often. Sometimes I assess their nervous system because through assessment of certain reflexes, you can determine if someone is in a good state of central nervous system or it's exhausted. There are a few tests We can play. We don't have a environment to that, but we can play a bit with that. And based on that, if they are exhausted, sometimes all they need is just to relax. You see, even if the pain is psychosomatic, sometimes people need to talk about that. There are different models of work, like breathing, right, exercises that help to move through something. Sometimes people just need to relax, and not very often, but sometimes, when I see that okay, it's this, sometimes I just do a massage. Like basically, I just put oil on the patient, and we just do very nice soft massage, because sometimes there are no lessons in very hard situations. Sometimes sometimes we just need the support. Sometimes we just need a moment to relax and to feel that we have some sort of support. And sometimes I am that person. I'm not exactly an expert in tapping to that yet, as much as I would love to be. But these situations happen. I would love to be better in that. Perhaps next year I will finish more training towards that. But hopefully I answered your question.
Yes, you did. Actually, speaking of which, you mentioned a very important topic that popped up something in my mind. I once read that. Do you know that how usually people say that we have this neck pain, which is around, let's say, the trapezius area and so on, it doesn't go? I was reading once it could be because of mental stress, and because people usually think too much, and because of anxiety sometimes. It could be not because of, let's say, a physical or a mechanical pain. So one of the doctors that I was reading the article from, he was saying that sometimes relaxing or meditation can solve that kind of a pain. What do you think to that? Like, I mean, could it be the case? Like, is there something to that? Let's say.
There are few layers of a problem, few of them. And let's start with the most superficial one. On the most superficial layer, you have bad sleeping position. Like, for example, you just compressed yourself, right? And you woke up like, sometimes you did a movement that you were not training before, or you were competing with a friend, or didn't warm up as good as usual, something popped. And the inflammation kicks in. The inflammation can kick in even for up to 48 hours later. So sometimes people don't associate these things. Like me, I was playing a bit with my friend. We did skin the cat exercise. I didn't do that. Something popped. Only 24 hours later, my neck pain started. So it's worth to show people that, because if you do movement for the first time, do it easy, warm up good, because it increases the risk of injury. And this is the first layer, the most superficial one. It's good to know that. It's good to know that, basically. There is a deeper layer that also I educate people about that, because that's important. If you are sleep deprived, if your hydration level is low, if you eat a lot of sugars in your diet, all of these things make you stiffer. So they increase the risk of injury. Try eating a lot of carbs and stretch the next day, like sugars. Try to, when you are dehydrated, check how far you can reach with your fingers, right? All of these things make you stiffer, so they increase the risk of injury. But in the same group, there is a psychological stress. Psychological stress, which means argument, conflict, toxic environment in work, uncertain financial situation, moving, traveling. All of these things are in the same group. They all increase the risk that something may come out. There may be a problem, right? But your nervous system compensates that nicely. But you stiffen up a bit more, and then it comes out. And then you relax, the pain disappears. It's not subsiding, but it disappears. Now, when we consider that, it turns out that our health is very fluent, that you are healthy when you have no stress, when you don't argue with your wife, but you're not healthy when you argue. You can have an orthopedic-like pain without, just because you didn't sleep enough. Now, it opens few gates, right? Now you know. And now you know that if you are very stressed because of work, it's better to treat training more as a relaxation rather than pushing for PR, right? That's very important. If you argue with your mother, it's good to go back a little bit from these interactions for some time. So what does it mean? It doesn't mean that the argument caused your neck pain. It just stressed you, and that's why the problem that you usually compensate very well came out. But it's not the direct cause. And there is another layer. We go deeper. Now, on the deepest layer, there are those injuries, those surgeries that I mentioned, this tension around the jaw after the braces treatment, this scar tissue just underneath your tattoo, and they are tensing you up. They are taking some of the capacity of your nervous system. Your nervous system is using some of its capacity to compensate for that problems. And now, is your neck pain really caused by the fact that you slept bad in a bad position? Or maybe it's the fact that for a few weeks you slept for 6 hours instead of 8. The fact that you have an uncertain situation in your work. Maybe it's because of the wrist fracture that you went through. Maybe it's because of the scar after the appendix. You know, it's all it all adds up, and neck pain is just the top of the iceberg. Now, what you can do with it? You can address all of these things on all of the layers. If you have a neck pain, get a more comfortable pillow, right? Or something that helps you to sleep more comfortably until the pain subsides. Solve the situation in your work, right? Talk with people, manage that. If you cannot, if you see it will not change, just change your job. Now, on the deeper layer, work on the appendix scar, put some cupping there, massage that nicely with oil, release some tension. And this is how you resolve the problem. I don't look at the symptoms as with that much care, if that makes sense. I believe that you feel it, but it's not that important at the same time. It's the knee pain without the injury, the neck pain without the injury, the digestive system issues, the anxiety, the depression. These things, I wouldn't chase them. Like, what is the root cause of depression, right? We need to give this medication to this patient and it will be solved because some receptor somewhere in the brain. I prefer to look for chemical, physical, and psychological issues, like real triggers. And it may turn out that if we would release the appendix scar, your stress tolerance would be higher. And you would still have neck pain, but not because, not after sleeping for 6 hours, but after sleeping for 3. So congrats, you can push yourself more to have the same symptom, right? Amazing. Maybe if you would release that even more, would release the whole tension, you wouldn't have the neck pain when even while missing sleep. You will just feel shit overall, but without neck pain. Amazing, right? Now, the same with digestive system issues. If you have digestive system issues like constipation, yes, it can have a mechanical background. If you sprained your ankle, it can tense up your leg, tense up your abdomen. So there could be a little component of mechanics, right? We can resolve the ankle tension, and the constipation, it's not lasting 5 days. It lasts 3 to 4 days. Amazing, nice. Maybe some adjustments with the diet, maybe some work with the trauma, with letting go of some feelings that were stuck, and then there is no constipation. Amazing. So this approach is kind of better. It gives more freedom. Also, if there are some variables, if the massage, for example, regular massage with oil, just the relaxation measure, it will not solve your problem, right? If the root cause is here and you have a neck pain here, massaging the neck will not help. Maybe it will help for a few hours, maybe a few days in the best scenario. But why does it help if it doesn't release any tension that causes the pain? It's because it relaxes you. It works temporary for a few days, maybe a week, but it relaxes you. It gives you a reset. And then it allows you to live without pain, not because you resolve that, but because temporarily you feel better. When you will come back from holidays, you will have an amazing month. You will have amazing regulation because you don't experience stress, you see new things, it stimulates your endorphins, right? Endorphins turn off pain. But massage as well as the vocation, it's only temporary. It will not last. Why I like to work on old injury sites, on the scars, releasing these bubbles, how I call them, because it provides permanent improvement. So I do it once, twice, maybe 10 if the scar is big. Sometimes more in some cases, right? It's not gonna lie. Sometimes it's necessary. Necrosis, seroma, reopening of that scar multiple times, then it will take more, not gonna lie. But once it's done, the patient is not here. It's here forever. Forever. How long does it take? Forever. That's why it fascinates me so much because at some point, my patients, they don't need me. I have a space for more patients. And the patients, I don't see them that often, right? But they refer me, their friends, their family. And I prefer this model of work.
Yeah. Lucas, you touched on a very important topic, actually, when you mentioned that sometimes the massage or the momentary relief of the pain, the relaxation, gives you like a temporary kind of a sensation, unless we treat the root cause of the problem. So because people usually tell you that if you have this pain or so, just go have a massage. However, what I notice is after like a couple of days, the same pain comes back. So unless they treat the root cause of the problem, nothing major will happen. It's going to reset them. Probably for them to know that, okay, after the reset, so this is what's triggering me. This is the root cause of the problem. It's a very interesting topic. I want to get into the proper positioning for sleep. You mentioned that sometimes like the position that we sleep in causes some discomfort. So I think that people out there are wondering what's the correct position to sleep, because some are saying on the side, some are saying on the back, on the stomach. So what's the...
So there are two answers for that. The first one is that I wouldn't care about sleeping position at all. I would focus on making you better overall. What does that mean? If, because of the nose fracture, you have tensions around the nose, which will stiffen your head and neck. If because of these neck tensions, your rotation will be something like this, then the chances that you will have some pinch, that you will feel uncomfortable during sleep, that you will wake up tired are quite big. But if you will release this tension, if you will feel more comfortable, if muscle tension will be just better, when you will be able to rotate to the sides much more comfortable, then the risk of having some problems during sleep is much smaller. And this is if I can advise something for people who struggle with sleep, it's this. Work on something that stiffens you up. Get rid of that. Work on that. And then you will wake up just fine. This is the most important thing. But I understand that people need these answers right here, right now, because they don't have a therapist. Basically, there is no such thing as a perfect position for everybody. The best position is the one that helps you to wake up fresh. So, and also the position that you will fall asleep in is completely different position that you will wake up in. That so falling asleep, like I think the position changes every 1.5 2 hours, if I'm right. So there is some clock built in our bodies to move us around a bit. But I'm not sure even if that's true, so don't take my word for that. But it's built in that we need to move. It will not be like this. You will lay down like this and you will wake up. It never happens. So this is one of the reasons why we shouldn't bother. If there are a few things, however, that I would like to mention. If you wake up tired, please ask or record yourself sleeping, because it may turn out that you sleep with your mouth open. And that's pretty problematic because you overventilate yourself, so you can destroy the enamel of your teeth. So if something like this happens, then it's nice to try falling asleep on the side. Whatever happens later, that happens. But putting a kinesiology tape on the mouth can be a nice solution, right? To kind of force breathing through the nose, or maybe some clearing the nose exercises before you fall asleep. I think the breathing is the most important part. Definitely, it's more important than orthopedic part of the health, right? Right? If we don't breathe, there is no point in stressing about the spine. But regarding the spine, there is no proven method no proven model of sleeping that, or it's not even proven that sleeping destroys our neck in any kind of way. Like it's not happening. So if you even fall asleep like this, it's fine. If you wake up fresh, that's fine. If someone has a neck pain, then we experiment a bit, like lay down. So basically, in most of the cases, if someone has a neck pain on the left side, we want them to lay down on the left side, because if they move throughout sleep, then they use the healthy side. So it's not being triggered, so they don't wake up. So they have a good night's sleep. So I ask them, fall asleep on the left side. How they will wake up, it's, it's up to their body. The height of the pillow, if someone has a problem moving here, then big pillow. It's nice to start with a big pillow. If someone has a problem here, then try sleeping without a pillow. And we play a bit with that. But as I told you, there is no amazing thing. I don't think that's telling people that there is something, that there is a perfect sleeping position is the thing. Also something worth noticing, if you change the mattress, if you change the pillow, especially when you travel, so you move to a different place, different mattress, different pillow, it increases the chances that something may go wrong. Like it increases the chances that you may get a pinch.
No, I just want to, yeah. On a final note, Lucas, do you have like any advice that you can give, let's say, everyone out there from your experience, from your years of work, and from your specialty, to close up the episode with? So basically, I need like, if you can give us like a model or an advice for the general public to live with from your experience, basically.
Basically, I think people would be much happier if they would work on their scars the soonest that they heal. That's my strong recommendation. On my channel, I very often share how you can work on your own scar. Hardly recommend to visit, guys. And basically, just having in mind that if you went for the surgery and sometime later some pain started, have that in mind that these two things, there may be a causality. So just having that in mind can solve you a lot of problems, a lot of stressing, and a lot of unnecessary treatments. Because while knowing now that, you know that you can help even yourself quite much, and it can save you 50, 60, like some patients, they went through 100 sessions of physiotherapy without solutions. That happens very often. So just knowing that if the physiotherapy doesn't work, if throughout few sessions you didn't notice improvement, it's time to change the therapist, because whatever they say, it's like I would say, if I cannot provide the patients, or that's a good idea, that's a good advice. If the therapist cannot provide you with the even 10, 20, 30% of relief throughout 2 to 3 sessions, then it's time to change the therapist. With strength training, it lasts a bit longer. I talk about the manual therapy, massage manual therapy. If someone is not able to give you something, even small improvement after 3 sessions, it's time to change the therapist. That's my opinion, based on my experience, based on what I know. Yeah.
Thank you very much. Lucas, thank you so much for being here. I really do much appreciate your time and wish you nothing but happiness for you and your family. And I wish to see you in the future. You're most welcome. Thank you very much, buddy. Thank you. Thank you very much.